THC versus CBD, differences, advantages, and disadvantages. Cannabis herb is seemingly normal family Cannabisaceae plant, has two main varieties are common, Cannabis indica and Cannabis sativa. But this plant, its flower or rather, the real magic is hidden from view. Plant a number of chemical compounds, and these unique cannabis called cannabinoids plant. Delta-9 tetrahydrocannabinol, THC, and cannabidiol, CBD, are the two major active ingredients and the most studied of the plant. Cannabinoids act on user by interacting with specific receptors in certain cells in the brain. It is also able to visit with many processes in the cell by regulating the expression of certain genes and other genes delay. This happens, for example, cancer. The nature and size of the effect depends on the type and quantity of material and form in the brain cannabinoid interaction with him. Mood, motivation, memory, cognition, perception, and motor functions are affected because of their major greatest number of cannabinoid receptors. In recent years, medical research exposed that both substances can have very different effects on the mind and body. Large differences in small effects. What is THC? THC is the primary psychoactive ingredient in marijuana plant. In other words, is the main cause of the high sense-linked marijuana use. The compound works by mimicking the effects of cannabinoid, neurotransmitter neurocalidonia produced naturally in the human body to help regulate sleeping and eating habits, and in addition also linked to pain perception and sensing. The main effects: calm, sense of sight, hearing and smell sharper, tiredness, hunger, reducing aggression. What are the medical use of THC? Studies have shown a positive correlation may alter the cannabinoid is able to contribute treat side effects of symmetrifa reducing nausea and vomiting, while increasing appetite. Multiple thoughts distortion improves muscle and bladder function and reduces the distortion's critics and major pain. Gloacum reduces intraocular pressure. AIDS relieves symptoms by increasing appetite and eating. Vulnerability SDRH reduces vibration. What is it? CBD. CBD same chemical formula as THC, but a slightly different arrangement of atoms. CBD holds about 40% of cannabis extracts, and a siroto this, coupled with the inability to create the effect of high, making it a serious contender for medical use. Among its effects: reduce symptoms of psychoactivity, relieve spasms and nausea, reduce anxiety, reducing infections. What are the medicinal uses of the CBD? Studies have shown that the CBD reduces symptoms psychoactive, reducing depression symptoms, reduces social anxiety. Stick to treatments symmetrifium increases appetite and reduce nausea and pain. Psychoactive properties. The main difference between the two is the extent to which cannabinoids are psychoactive, or mind-altering. Essentially, THC is known woman of strong psychoactive properties, and this compound that gives the feeling of floating, high, famous. She stated the main reason that most people currently use marijuana. CBD, however, considered to be anti-psychoactive, gifts to high and a number of other negative effects of THC, particularly related to anxiety and psychosis. Anxiety. Cannabis is known may create feelings of fear and paranoia among people, especially when consumed in large quantities or by people who are not experienced. This effect can be attributed to THC. On the other hand, the CBD has been shown to reduce the anxiety caused from THC and may also reduce general anxiety resulting from other factors. And several studies have shown that when consumed in the right dose, CBD could reduce social anxiety and discomfort during the general public speaking, the most common fear among humans, and other anxiety-provoking situations. Psychosis. In recent years, are evidence of the link between cannabis use and the emergence or worsening of psychosis, often described as the loss of part or all of touch with reality. Once again, it seems that the THC is responsible for running trigger these symptoms, while CBD endowed with antipsychotic drugs, therefore may alter the cannabinoid that can be helpful against psychosis caused from THC or other factors, and as a result, is currently being investigated for the potential inherent in it as a cure for patients with schizophrenia. Cognition and memory. THC is suspected of having an acute impact and long-term parts of the brain that are important for learning and liscron. A body of research from the United States developed a mechanism where you can see the CBD thereof neurofractibiote features, which reduce the disadvantages caused by cognitive and omidim from THC. Studies have shown that cannabis with the same amount of THC but variable amount of CBD have yielded variable results of the learning abilities changed. One of the more common reasons reported for the use of cannabis is that it helps to better quality sleep, and sleepiness and fatigue did an excellent general side effect of the drug. But now research findings that examine the relationship between the two are not completely clear, and yet most people believe that the THC is the one that contributes to fatigue, while the CBD is considered more material raises pain, infections and nausea. On this matter, THC and CBD also been proven particularly useful as analgesic, but CBD attach more anti-inflammatory properties. CBD, perhaps in cooperation with THC, is also in charge of the suppression of muscle spasms resulting from various diseases such as Parkinson's disease, and reduces nausea, so he investigated a bit more in the context of medical use. Seizures. There is evidence that current within the CBD may contain anticonvulsant effect, attack frequency and severity. But the problems at the moment on this issue, most of the information that we have made thanks to animal experiments, we significantly different physiological sense and sensitivity and response to different drugs. So with some reports made people available information on this area is lacking right now. Legal status. While in most countries there are strict rules regarding the use of marijuana and THC, CBD situation is somewhat uncertain. The U.S., for example, the CBD is considered technically a legal drug first degree by federal law. But its summarized form called Epidiolex, recently approved by the Food and Drug Administration, as optional drug that helps children with severe epilepsy. In addition, CBD hemp oil is also considered illegal in the United States and Israel. Why CBD is more commonly used in medical than THC? Eventually, cannabis is a drug rather complex. Sometimes the reciprocal effects of two cannabinoids may explain the reason for the different feelings that people experience when they use the plant. Today, widespread use of cannabis for purposes of pleasure species contains a lot of THC and CBD little, and maybe this is why exceptional cases in which people are injured as responses to use discord plant. THC is still classified as an illegal drug with side effects of consciousness evident in the long term, including impairments in thinking and logic, reduced ability to plan and order, impaired judgment, and impulse control, less impulsive. In addition, it was argued in the past that the use of THC linked to chronic dysfunction of the heart and brain. CBD, however, lacks any of these cognitive defects, and even contradictory quite a bit less desirable effects that medical use. Today, the medical cannabis industry trying to create strains that contain varying concentrations of THC to CBD in order to adapt the plant for any illness or symptom individually, so that they best results. Overall, the limited health risk of the CBD combined with efficiency, making it the leading candidate for little more than the medical use of THC.